Hey there, my name's Dustin. I'll be the RN doing your assessment today. I'm going to be conducting like a 20-ish minute assessment on you today. At any point in time, you can stop me and ask any questions. Is it okay if we do this assessment?
Yes.
Okay. Everything that we're gonna do here is gonna be confidential and it's gonna be private. Everything that we do is going to stay here. Okay.
Okay.
All right. If you don't mind, I'm gonna take these from you. So we did her vital signs prior to starting this recording. Her heart rate was 82, blood pressure was 112 over 80, respiratory rate of 14, temperature of 97.8. And are you in any pain right now?
Mm-hmm.
So her vital signs are within defined limits. All right. So the first thing that I'm going to be doing is asking a few questions. Okay.
Okay.
All right. Can you tell me when you were born?
September 6th, 1994.
And can you tell me what date it is now?
October 10th, 2021.
All right. And can you tell me what all you've done today?
I went to church, I went home, watched TV, and then I went to my mom's house.
Okay. And then can you tell me who the president is?
Joe Biden.
All right. And can you tell me where we are right now?
We're currently at my mom's house in Cabot.
All right. So I would say that she is oriented ×4. Her facial expressions have been appropriate since we've started. Her speech has been non-hurried, non-rushed. Her mood is appropriate. She's cooperative and calm. Her affect is appropriate. Her attention span has been appropriate. All right, so I'm going to be doing a test called the 4 unrelated word test. I'm going to repeat 4 words and have you repeat them back to me.
Okay.
Car, dog, apple, and house.
Car, dog, apple, house.
All right. And then can you spell the word world for me?
WORLD.
And can you spell it backwards for me?
DLROW.
And what were the 4 words that we just talked about?
Car, apple, dog, house.
Awesome. All right, so the first thing that I'm going to be assessing is your head. If you don't mind, I'm just going to take a look up here. There's no sort of manifestations or alopecia that I can see at all. Her scalp is white. Her hair is evenly distributed. It's brown. It's straight. As far as her face, there's no sort of lesions or abrasions. As far as symmetry goes, her eyes are on the upper third. Her mouth is on the lower third. Her nose is midline. There's no sort of deviation at all. I'm going to assess some cranial nerves with you. The first one that I'm going to assess is the trigeminal, which is cranial nerve number 5. I'm going to have you just clench down real quick, and then I'm going to feel right here. All right, so her mastoid and temporal muscles are strong. I would say this cranial nerve is intact. And then also, I've been assessing cranial nerve number 7, which is the facial nerve. There's no sort of drooping. Her expressions have been symmetrical. And then lastly, if you could take off your glasses and close your eyes, I'm going to try and have you resist me opening your eyes. So I would say that this cranial nerve is also intact. And then I would also assess cranial nerve optic 2. You can do this using the Snellen chart. We would place this chart 20 feet away, and we would use a 3x5 index card on both eyes. We would do this with and without glasses. And then we could also test for color using the colored circles as well. All right, next I'm going to be assessing your eyes. She is wearing glasses. There are no signs of abrasions or drainage that I can see. Her eyebrows are symmetrical on both sides, evenly distributed. Her eyebrows are everted. There's no sort of jaundice in her sclera. The color is even and on both both sides, same color. And then I'm going to go ahead and dim the lights and shine this light to test your pupils. Alright, if I could have you look at me. Alright, and then I'm going to turn these lights back on. So I would say that her pupils are equally round and reactive to light. If you could just look at me and then look at the wall way over there, I would say that they are accommodating to near and far-sighted objects, and her pupils are approximately 3 millimeters. So there are 3 nerves that I can assess with you, which is cranial nerves 3, 4, and 6. This is the oculomotor, trochlear, and abducens. And I'm going to test these by testing the 6 cardinal fields. If I could have you just look at this pen and not move your head, you're just going to look at it with your eyes. Alright, so I would say that those are intact. And then I would also be assessing using an ophthalmoscope if I had one. I would go in at about a 20-degree angle, and I would also be looking for the red eye reflex, which would be normal. Alright, next I'm going to be looking at your ears. If you could pull your hair back for me a little bit. On first sight, there's no sort of irritation, drainage, or anything like that, or any manifestation. We'll look in here with the light. There's a little bit of cerumen. Is there any tenderness on your ears at all whenever I'm messing with them?
Mm-mm.
Okay. How about tenderness right here? Right here. So there is no tenderness on her mastoid, process, tragus, or auricle. Her ears are elastic. She does have 2 piercings in the bottom of her ear. They're symmetrical with the cerebral fissure. So the next cranial nerve that I will assess is cranial nerve number 8, which is the vestibulocochlear. To do this, I'm going to have you close your eyes and then occlude one of your ears, and I'll whisper a word and you tell me what it is.
Chair.
Alright. And then on this side.
Picture.
Yes. So she got both of those correct, so I would say that cranial nerve would be intact. I would also use an otoscope to visualize her tympanic membrane, pearly gray, and then I would also be visualizing the bones, which are the incus, the malleus, and the stapes. And then next I'm going to be taking a look at her nose. Her nose is midline. There's no sort of deviation. If you don't mind, take off your glasses for me. I'm just going to feel on your face right here. Do you have any sort of tenderness at all?
Mm-mm.
Okay. So her maxillary and frontal sinuses are non-tender. If you could close one nostril and breathe in and out for me. So I would say that her nares are intact and patent bilaterally. Next, I'm going to be looking at your olfactory nerve by doing a smell test with you. I'm going to have you close your eyes and occlude one nostril, and then I'm going to put an object in front of you. If you could tell me what this is.
Smells like soap.
Okay, and then if you could keep your eyes closed and include the other nostril, I'm going to put this one in front of you. And you can tell me what this one is.
Smells like vanilla.
Yes. So I would say that her olfactory nerve would be intact. Next, I'm going to be looking at your mouth. Her lips are red and moist, and they're symmetrical. There's no sort of cracking or abrasions that I can see. If you could open your mouth for me, just looking at your teeth. If you could smile real wide for me. All right. I would say that her teeth are white. There's no sort of dental caries at all. There's no sort of hardware that I can see. It looks to me as if everything is appropriate. If you don't mind, I'm going to look at the inside of your cheeks. So her buccal mucosa is pink and moist. There's no sort of irritation or redness that I can see. If you don't mind, I'm going to look in the back of your mouth at your tonsils. If you could stick your tongue out for me. I would say that her tonsils are +2. They're non-reddened. They're not inflamed at all. And then also I'm going to be looking at your uvula in the back of your mouth. And this is going to be assessing cranial nerve number 9, also called the glossopharyngeal. If I could have you stick your tongue out and then say ah for me. So this cranial nerve is intact, the uvula rises and falls appropriately. And then also I will have you stick out your tongue and move it side to side. So I would say that her tongue protrudes midline, and this shows that cranial nerve number 12, the hypoglossal, would be intact. If I can see the top of your tongue, and if you could lift your tongue up. So I would say that the dorsal surface of her tongue is pink and moist and roughened with papillae. The ventral or underside of her tongue is smooth and has veins appropriately. All right. And then also, if I could have you smile real big, I'm just gonna look at your gums. All right. I would say that her gums are intact. They're non-irritated, non-bleeding. It looks to me as if there's no signs of irritation that I can see. All right, so next I'm going to be looking at your neck. If I could just have you move around and then look up and down. I would say that her range of motion is full and intact. If you could just move your neck around. There's no palpable or audible crepitus that I can feel. Her sternocleidomastoid and trapeze muscles are strong and intact. And then the skin is still tan, appropriate with the rest of her body that I can see. There's no any scars or lesions. And then lastly, I'm going to be checking cranial nerve number 2, which is your accessory nerve. To do this, you're just going to move your head around again for me. And then I'm going to have you resist my hands and shrug your shoulders. All right, so cranial nerve number 2 seems to be intact. And then if I could have you move your hair for me. And then if you could say the words 99.
99.
99.
99.
All right. So her tactile firmitus is intact. I feel vibrations. That is appropriate to me. And then next I'm going to be listening to your chest. If you could turn towards the camera just so they can see. if you just want to stay like that and put your arms out right here, I'm going to listen to your sides real quick. Alright, and then if you could turn around so the camera can see your back. I'm just going to listen to your back real quick, and if you can move your hair to the side for me. Alright, Kylie, you can face me. Listening to her lung sounds anteriorly, laterally, and posteriorly. I did not hear anything abnormal, no crackles, no wheezing, no adventitious breath sounds. Everything sounds clear. Bilaterally, I can assess her AP to transverse ratio, which would be 1 to 2. There's no sort of barrel chest that I can see. I did not feel any sort of bumps or lesions or any. Do you have any sort of pain at all? Her chest expansion was symmetrical. If you could take a deep breath in and out. Next, I'm going to be looking at your skin that I can see. I'm just going to take a look here. There are no sort of scars or abrasions or anything that I can see out of the from here. She's not excessively dry or sweaty at all. If you don't mind, I can take a look at your hands. Her nails are intact. They're translucent. Her nail beds are all intact. There's no signs of clubbing. They're all convex. And then if you don't mind, I'm just gonna look at your capillary fill on both your fingernails and toenails. Awesome. And then if you don't mind, I'm gonna pinch the back of your hand. Alright, and then I'm gonna pinch up here too. So her skin turgor is non-tinting. Everything looks to be normal or within defined limits. And then also, I would be doing a breast exam with you. So to do this, I would have you sitting, and you would raise your arms up. You would place them on your sides, and then you would also lean over. I would be assessing you in all 3 positions. I would be assessing for any masses, lumps, dimpling at all, any sort of striae, increase in vascularity. Your areola would be darker in complexion. Your nipples would be everted. There would be no sorts of masses or anything that I could see. and there would also be no edema. We could check this, check your lymph nodes. We could check your central, lateral, and then anterior and posterior axillary lymph nodes for edema. And then also I could use palpation. There's 3 types. I could do spokes of the wheel, which would involve in and out, just like a bike tire. I could do vertical, straight up and down from the axillary, or I could also go in a circular motion as well. And then also you could squeeze the nipples, and there would be no drainage, would be a normal sign. And then lastly, could you tell me the 4 words that we talked about earlier in the video?
Car, house, apple, dog.
All right, so her recent and remote memory would be intact.